It's time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hello, listeners. PetSylvania, Dr. Bob here. I'm really happy to be on the air with you again today. Thanks, Dennis. That was really great listening for the last 3 hours. So I hope I can match with your quality with my PetSylvania today. I want to thank Elanco, one of my sponsors, the makers of Trifexis, Comfortis, Prozac product, Reconcile. And then, of course, I want to thank Sylvania Vet, my office, for being the sponsor, 4801 North Holland, Sylvania Road at Haroon, 419-885-4421. I want to emphasize today the special nature of how we board cats, and it's really pretty special. Every cat family that's with us are in a custom-designed vertical cataminium, we call them. They have a picture window overlooking a garden so that in the summer there's lots of flowers and birds for them. That enriches their stay and it reduces their stress. There's also a sleeping loft, so if a cat is stressed and wants to get up and be alone, it can get up into the sleeping loft. There's multiple levels to climb for. Each cataminium is individually ventilated, odor control. Cats that are with us are weighed every day. Their temperatures are taken. They're allowed to roam the premises depending on how many cats are in our care. That's going to determine how much time they have to get out and get a little bit of exercise. But they're given very, very special care in an area that's completely removed from where any dogs might be. So it's very stress-free from the cat's perspective. And then our newest sponsor, which is Esplin Medical, the makers of a high premium, high quality surgical scrub in 4 colors: jade green, navy blue, Caribbean blue, and seal blue. These are made 55% bamboo, 25% cotton, and only 20% poly. And that's from recycled plastic bottles. So very environmentally friendly, so comfortable you'll think you're working in your pajamas. So I would encourage you to go to www.esplinmedical.com and you can learn more about bamboo fabric and its antimicrobial nature, and then you can actually order these premium scrubs that are really priced at a place well below what you would pay for a truly premium scrub. Urinary bladder stones occur in dogs and cats with some regularity, and depending on the kind of stone, it really determines the reason why they get it. But one of the factors frequently is diet, and so we always recommend that you feed a high quality premium diet that is balanced and does not have excessive amounts of acidification, does not have excessive amounts of calcium and phosphorus in it, because those all can contribute to the development of the stones. The 3 types of stones that we commonly see are a struvite stone, which is a calcium, magnesium, phosphorus stone. We see that in cats and dogs. And it was, at one time, it was the most common kind of stone, but all the commercial diets started acidifying their foods. And so what we've done is we've kind of decreased the incidence of struvite stones, but we've increased the incidence of calcium oxalate stones because those form in a more acid environment. It's a really tough thing when you are trying to feed commercial foods. That's why we really recommend the high-quality premium diets. And the third kind of stone is an ammonium urate stone, and almost every cat or dog that has an ammonium urate stone, the Dalmatian being the most common, has some form of metabolic problem. They may have liver disease or they may have an inherited problem associated with uric acid, as does the Dalmatian, and they require very special care and very special dieting in order to try to prevent the development of those stones or a redevelopment of the stones. The sad thing is that once a stone's been removed, and we have to do that surgically in most cases, if we aren't really super diligent with our diet choices and with the other necessary steps, increasing water consumption, managing the pH of the urine, they're going to reoccur. And some dogs, Schnauzers and Bichons, are what we consider stone formers, and it's not uncommon for them to have multiple episodes of bladder stones. Flying your pet. Many people will take their small breed pets and they'll put them in a carrier, and whether that be a puppy or a small dog or a cat, and they'll take them right up into the cabin. And that's certainly the safest way to fly your pet, is to have them in the cabin with you. And there is some movement I saw in the literature several months ago about some airlines banning animals in the cabins because of animal allergies in other passengers. And so it's an interesting concern learn, and I think that would disappoint a great many people if they weren't able to fly with their pet in the cabin. The rest of the animals, the bigger animals, if their animals are going alone, they're going in a carrier and they're going in the hold, and the hold is pressurized, so it's safe and the temperature is controlled in there so it doesn't get too cold. What we recommend is that you do not sedate your animal when it's going to fly, particularly if it's going to fly in the hold, because what has been learned through the sadness of reports of animals having trouble is almost invariably the animals that have had trouble flying, if they were healthy when it started, but they were sedated, it's the sedation that causes them to have problems, including death. So I'm always a little bit leery. I mean, if you're just going to Florida for a week, I would not recommend that you fly your dog with you. And if you're going to go for a longer period of time, you're probably going to drive and then you're going to be all right. If you're going to send your pet overseas, I can't emphasize how important it is that you get all your ducks in a row on that. Talk with the consulate of the country to which you're going. We had a big ordeal this week with a cat that's supposed to go to Korea. The owner is a Korean national who does not have really good command of the English language at this point, and she does not understand, and we have not been able to get her to understand that if she tries to take this cat home to Korea, it may not get it out of the airport because she won't have had all the necessary testings, the exams, the rabies vaccines. There's a lot of requirements depending on the country you're sending it to, or even the state. Hawaii is pretty tough on bringing an animal in. So if you're going to be moving to Hawaii, then it's going to be worth all the hassle. But if you're only going for a vacation, it's probably not worth the hassle trying to take your pet. I had a dog in this week that there was some concern about him having difficulty jumping up, and the owner said, well, I think he's got arthritis. So I'm thinking, well, maybe. We got some pain in the hips and there's some muscle wasting, but, is it only the hips that we have arthritis in? Are there other joints? And so we always like to verify, what is it arthritis? Because we had a dog, Zorro, that we had the same comment, think it's arthritis. And when we ended up x-raying this dog, turned out all its joints were pristine and there was no problem. And with some further evaluation and the passage of time and the failure to respond to pain medication, we determined that Zorro had a degenerative myelopathy of the spine and progressively weakening nervous system in the back end. Now, the dog we did this week had horrific hips. I mean, really bad hips, great knees, great ankles, and then some stiffness and some arthritis in the spine. Now, with that knowledge, we're going to be able to fine-tune some treatment, which might very well include laser therapy, or even at its greatest extent, we can do stem cell therapy and inject the joints with stem cells, and it has a dramatic effect. I've talked about that before. It is something that if you have an older dog with arthritic joints, you should give serious consideration to at least learning about stem cell therapy, because I think you'll find it will really be beneficial. There's about 8 or 9 steps that we take a dog through, or a cat. Dogs, their arthritis is more frequently in the back and the lower, in the legs and the hips, and in the back. Cat, it's frequently in the elbows, but we can manage those with progressive multifactorial treatment modality. So, boy, that's a lot of big words. In other words, we can use a bunch of different things to help your pet be more comfortable with their arthritis. So it's time to take a break, and we'll be back. Well, my producer, Steve, asked me, is the stem cells that we were just talking about, is that as controversial as it is in the human arena? And the answer to that is no, because the concerns in the human arena have to do with stem cell research and where those stem cells are gotten. They're getting them from fetal umbilical cords, and that's not an issue for us. And so we don't have the political issues. Where we get our stem cells when we're doing stem cell therapy is that we harvest it from fat that's in the abdomen of a dog called the falciform ligament. So we take the dog for a very minor abdominal surgery, harvest the fat, send it to the vet stem people. They process it and send it back within 48 hours, ready to be injected into the affected joints. And there are a couple of systems out there that enable you to do it, stem cell harvesting in the veterinarian's office, but there are about 150 steps to this. The sterility, the quality, the fact that you won't even know if you have stem cells tells me that that's not the way that I think it should be done. If we're going to do something that sophisticated, we're going to use the Cadillac of stem cell therapy, and that's from the vet stem people. So I had another question. This one is from Casey, and it's great. She likes to listen, and so I'm hoping she's listening today so that we can talk about that. She says, I have a question about my two dogs. One is very territorial over food and water dishes and won't let the other dog near them. She will even lay in front of them when she isn't eating. She doesn't do this with anything else. What do you suggest we could do to make her stop? I think the easiest way, sometimes you pick your battles, Casey. And in this case, what I would do is I'd feed the dogs in two different areas. It's impossible for the one dog to defend both spots. And so, or put your one dog in a room with the door closed and then pick the dishes up. You can put water in a couple, three different places so that it's real easy to get to water when we need it. And then we don't have food dishes to protect. I think I would just do that. And then gradually, when the dog realizes it's not going to be need to or be able to be protective of that, the problem should go away, and then ultimately you may be able to feed in the same room again. Unless it's impossible for you to do the separate feeding areas, I think that's the simplest solution to that. We have a new methodology of managing small skin growths, and it's a cryosurgical pen. In the past, we've used a process called Verruca Freeze, and it's worked pretty well, but not as well as I would have liked. So we kept looking for better technology, and what we did is we found the cryo pen. And the cryo pen, the temperature of the nitrous oxide is about 50 degrees colder, so it's more effective, and we can be a lot more precise, and it's not quite as noisy and disruptive to a dog's hearing, particularly when we're doing these growths up near the head. And we've had great success with the cryopen. So, if you have an older dog that can't handle sedation, or if it's just a minor little thing that you see, boy, I hate to do anything but I'd like to get rid of that growth, the cryopen's the solution to that. Give us a call, 419-885-4421, to learn more about cryopen and to see if growths on your dog or cat might respond. We've talked a lot about the American Animal Hospital Association and what that means. I want to continue to emphasize that because it's amazing to me the number of clients, even our clients, but the number of pet owners that have no idea what AAHA certification means. And in a nutshell, it means we are inspected and certified that we meet a minimum of 900 quality standards in the way we administer veterinary medicine to a pet. And in the Toledo area, there are only 3 practices that have AAHA certification. And I think that you should be considering that when you think about choosing a veterinarian. Sometimes the guy just closest down the street is not the one you want to go to when something significant needs to be done. And of course, we'd like to have everybody that really values high quality care come to us. And even if we're not down the street from you, we're a regional veterinary practice. You can get anywhere in Toledo in 20-25 minutes on a nice day, and it's absolutely worth the drive. In most cases, you're only going to the veterinarian a couple of times a year for routine kinds of stuff, and you know that we're there for you with emergencies as well. So one of the really basic things that you might be really appalled at knowing is that the state has no criterion, and so your veterinarian is, unless they're AHA members, are not required to wear caps, gowns, and masks and use new sterile packs in every surgery that they do. And again, even if they don't do that, there's nobody checking them out and making sure that they're meeting those standards. So I want you to think about that when you're thinking about choosing a veterinarian. I had a client in, as a matter of fact, the client I was talking to you about with the dog with the arthritis, and we scheduled it and took his x-rays, found some pretty bad hips in the lower back, if you remember. But he had told me that he'd been giving him some ibuprofen, and it seemed to help. That, oh my. So I'm a little worried about that because we've talked about that before. I said, you're not aware that ibuprofen can trash your dog's kidneys, and he was not aware of that, obviously, or he wouldn't have used it. But there's nothing over the counter that's really safe. Ibuprofen can do serious damage to the kidneys in the dog. Naproxen, which is Aleve, can do serious damage to the stomach and can cause fatal GI bleeding. The aspirin, which is probably the safest of the over-the-counters, but still as little as 1 dose can cause beginnings of gastric ulcers. It's as little as 4 doses will slow down the clotting mechanism. Tylenol in dogs and cats can do serious damage to the liver. Grapes and raisins, of course, are potentially toxic to kidneys, so we don't want you giving your dog grapes and raisins. And then everybody always worries about chocolate. Chocolate's a concern, and it in large quantities can be toxic. It's not the big deal that we all tend to worry about. What do you do if your dog nails grow too long and then the blood vessel grows out too far? We try to do before we put them under and try to cut those all the way back, because then they are really going to bleed, and they're going to be painful, and it's going to need to have bandages for a week. And so that's kind of a big ordeal. If you work with the Dremel tool, you trim them back as close as you can, and then use the Dremel tool. Gradually, you can kind of work nail back to the length that it's supposed to be, so that the dog's nails are not excessively long. Plus, the Dremel tool will make them nice and smooth, so that it'll be less damaging to like a hardwood floor. It's something that's well worth doing. We can teach you how to do that. In addition to that, we find that just a little in the long-haired, thick dogs with floppy ears, like Cocker Spaniels and a lot of the other dogs whose ears are really heavy with hair, if you do a little bit of special grooming and cut the hair on the inside of the flap and around the base of the ear canal and cut that real short, we get better airflow into the ear canal, and that will really and truly help prevent ear infections. And so that's something simple. And when you take your dog into the groomer, just ask the groomer to kind of make the inside of that ear look at some marine buzz cut. That should help a lot. We had a dog that we sent home today, had been vomiting for 3 days before it came into us. And when we saw it towards the end of the day on Sunday as an emergency, took an x-ray, we saw something that was abnormal. And so we took it the next morning to surgery, and we removed 2 pieces of a binky from the dog's small intestine. The take home on this is that if your dog or your cat is vomiting, without taking anything in, and it's vomiting for multiple days, and it may or may not be having bowel movements in it, and it's not eating, that is not something that you want to wait on, because if there is a foreign body, ultimately that foreign body is going to cause death of the intestine, and then there's a decent chance we're going to lose our patient, or at the very least, the dog is going to, or cat is going to lose a significant part of the intestinal tract and then we have to sew it back together, and that's called an end-to-end anastomosis. Well, it's time to take a break, and we'll be back to wrap it up. Few things to talk to you about and tell you about here as we wind down PetSylvania. On Saturday and Sunday, January 26th and 27th, at Monroe Community College, there's going to be a cat show. You cat lovers, that might be a really fun way to go and take the kids and see a lot of beautiful cats. And some of them are household pets, and some of them are purebreds. It's going to be a lot of fun, and I would encourage you to do that. Every Sunday at 3 o'clock, we have Zumba classes in the Learning Center at Sylvania Vet, and you're welcome to just walk in and come join Zumba. Go ahead and call and get your name on the list. Sarah Adams, one of our employees in the kennel, is also a certified Zumba instructor, and she's having a lot of fun, and the people that are coming having a lot of fun. Today, for the next 3 hours, this is Saturday, we have a blood drive going, and I gave blood at 9 o'clock this morning. So we've got a couple of openings. If you give the office a call, if you want to come donate blood to the American Red Cross, we would certainly encourage you to do that, because it's good for the community. We do these blood drives about 3 times a year, trying to help the community. I still have a couple of Northview t-shirts, Northview athletic t-shirts. So if there's any Northview boosters out there that would like to get either a large or an extra large t-shirt, just stop in the office. First come, first serve. I'm not sure what sizes I have left, but you're welcome to them. They're free. We are one of the sponsors of this t-shirt, and they provided us with a few to give away to people. And so I'd like Northview people to have those. Our obedience classes are all underway, and we'll be starting the next one in 4 or 5 weeks, and I'll have the dates for you at our next visit. Last thing I want to do is I want to again thank Elanco for their sponsorship. I really couldn't do this without them. They are the makers of the next generation of flea control and a form of Trifexis and Comfortis, and it's something that you should be using year-round, flea control and heartworm control. Sylvania Vet, I just really want to emphasize that we're available 24 hours a day, 7 days a week, 365 days out of the year for routine care during the day and emergency care after hours. ours. Your pet's never alone at Sylvania Vet. I want to thank Esplin Medical, and I encourage you to go to esplinmedical.com and check out bamboo cotton scrubs. They are nothing like you've ever worn if you're a medical professional in any of the medical professions, and I think that you might even like buying them just to bang around in the house because they are truly comfortable. Sylvania Vet and myself, as Robert Esplin, have a presence on Facebook. We'd encourage you to like the Sylvania Vet page and make friend request of me, and I won't refuse you, I promise, because this is another opportunity and another way that I can get asked questions, and I can pass on information about pet care, and I can pass on information about what's going on at Sylvania Vet. And occasionally I get into a political rant on there, but you can just ignore that. But the main purpose of my being there is to promote high quality pet care. So as we wrap up today, I want to say that there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.